Hello, my fellow nurses. My name is Armando Ebbay, and today I'm here to encourage you to become better educators. According to Vertino, 80% of serious medical errors involve miscommunication among healthcare workers. As a registered nurse, I know that ineffective communication may result to tragic consequences ranging from job disappointment to patient harm. I know that my patients rely on me to save them. They rely on my communication skills to save them from preventable medical errors. Being able to communicate effectively doesn't only save the patients, but it also boosts our morale as nurses, increase our job satisfaction, and increase our work productivity. Therefore, we nurses should learn how to develop our communication skills by developing our active listening skills and assertive communication in order for us to prevent miscommunication and misunderstanding that may lead to job disappointments and adverse patient outcome. Developing effective communication encompasses developing our active listening skills. Through active listening, we nurses should focus on the complete message being said by the speaker, not just by the words. Okay, being able to listen actively involves our body language. When you listen, you don't do this. Make sure that you look directly at your speaker while leaning forward so that you convey that you are interested in what the speaker is saying. Most importantly, suspend your judgment while you're listening to the speaker. On the other hand, nurses should also learn how to communicate assertively. What is assertive communication? I know that this is different from an aggressive or a passive behavior. Through assertive communication, we nurses can communicate our concerns, thoughts, and beliefs with honesty while respecting others' opinions and beliefs. Failing to do so according to Omura and colleagues will result to burnout. And you know what burnout is, my fellow nurses, and workplace violence. That's why we sometimes see in a workplace two nurses arguing, and it doesn't look good. If I were a family member and I see two nurses arguing, what should I think about these nurses? This hurt our image as nurses. It's just like Cohen, a registered nurse, how she would describe her colleagues not wanting their children to become nurses, because nurses are such a profession that is underpaid and not respected. When using assertive communication, it is important to say no. Learning to say no can be hard for us nurses because we are afraid of the fear of rejection and we might feel insecure. But you must remember that you will not like everyone and everyone will not like you. You must learn how to say no in order to deal with the inappropriate behaviors of the family members of your patients and your colleagues. Most importantly, you need to use I statements. I like, I appreciate, I think. In conclusion, being able to communicate assertively and listen actively will help empower us to deal with the inappropriate behaviors of everyone, including our colleagues, patients, and their family. It will also help us to overcome the different communication barriers that we encounter as a result of cultural diversity. And of course, being able to effectively communicate will also help us to provide safe care to our patients and also increase our work productivity in our field. So fellow nurses, let's go ahead and communicate assertively and listen properly when we converse. Thank you and have a good day.